that brings us to your weekly capsule of health information. We like to call it Your Healthy Dose, presented by Hannibal Regional Hospital and Hannibal Regional Medical Group. And in studio, we've got Kim Peters, who's a nurse practitioner with Hannibal Regional Medical Group, as we talk about the importance of diabetic education. And it's good to see you again.
Thanks.
Thanks for coming in. You've got a special event that's coming up. You're bringing in a celebrity coming in a week from...
tomorrow.
A week from tomorrow.
Yeah.
As a matter of fact, all part of this special academy, if you will. First, tell us a little bit about diabetes and why we should be concerned about it.
Well, like you said, I've been here before, and I've talked diabetes. It's a progressive disease. It affects almost every organ in your body. It's something that, we need to take care of at an early stage, and the best way we can do that is through education.
Eating healthy, watching our weight, getting plenty of exercise, especially if diabetes runs in our family.
Oh, yes. Risk factors for diabetes, obesity, family history, certain ethnic origins. If you have high cholesterol, if you have high blood pressure, if you're a couch potato, big high risk. Mm-hmm. If you're a woman that has polycystic ovarian syndrome, big high risk. So there's lots of risk factors that can be modified to help either prevent or keep diabetes from starting too early in your life.
It really is getting the word out there, and then people having to learn how to do all this to take care of themselves. Exactly.
If we as a society would follow a heart-healthy diet or a diabetic diet, the amount of diseases that we would be able to eradicate would be astronomical.
When you talk about a diabetic diet, what is that?
It's a diabetic diet is when you control your carbohydrates, and carbohydrates are pastas, rices, potatoes. Certain vegetables are starch, like peas and corn. Most beans except green beans. All kinds of breads, any desserts, other than just even fruit is a carbohydrate. It's good carbohydrate, but it all needs to be eaten in moderation.
Just like anything.
Just like anything. Just like anything. When you're actually diabetic, we look to try to have you count your carbs. 45 grams is generally the guideline for people at each meal. But when you're pre-diabetic, which is when you've stepped that toe down the road for diabetes, but you're not quite there yet, we look for a heart-healthy diet, which is watching your carbs, not necessarily counting them, but trying to eat more vegetables, trying to eat more fruits, get more exercise. Just try to take away the processed foods. Most processed foods are high in carbs, and if they're not high in carbs, they're high in fat or they're high in sodium.
How do you determine if somebody's pre-diabetic?
Several ways. We do fasting blood sugars. If your fasting blood sugar is between 101 and 125, you're considered pre-diabetic. If your hemoglobin A1C, which is your blood sugar average over 3 months, if it is anywhere between 5.7 and 6.4, you're considered pre-diabetes.
So this is all going to be done by a lab draw?
Yes, it'll all be done by a lab draw.
How does somebody know? What are the symptoms that somebody may have that they should suspect that they're diabetic?
If they're just not, sometimes if they're just not feeling right, they might want to have somebody check their blood sugar. But otherwise, if they have frequent urination, they're frequently thirsty, seem to be, if they're losing a lot of weight, especially if they're younger, they could be more leaning towards type 1 diabetes. With type 2, it's generally, we see that they're having increased infections like bladder infections. Otherwise, they're just, sluggish, don't really feel well. They're just coming in and saying, something's not right, I just don't feel right.
What's the difference between type 1 and type 2?
Type 1 is when your body has absolutely no insulin to help you process your foods. Everyone needs insulin and glucose to put energy into their cells. The glucose is the energy, the insulin is the key that gets it into the cells. With type 1 diabetes, and that's a lot of times seen in children, is that their pancreas just stops working and they have no insulin to give. With type 2, we see them generally later on, and I say generally now because with childhood obesity, we are seeing an astronomical increase in type 2 diabetics with children. And that's just a very, very sad situation. And because once they're diabetic, they're going to be diabetic their entire life.
Why such an increase with children?
The obesity. I mean, if we look at our childhood obesity rates, they have skyrocketed. And I mean, we have schools that are trying to fight that, but unfortunately, the draw of fast food and processed food, and just, the busy lifestyles that everyone has, it's leaning more towards the quick and grab it quick, and we're not eating as healthy as we should, especially as kids.
It sounds like it all goes back to intake, not only for adults, but what you're feeding your children.
Exactly. And what we're feeding our children is what they're going to develop their lifestyles for the rest of their life. I mean, the habits that they're learning when they're young is what they're going to continue when they're older. So if they're used to that, it's okay to grab it and go. That's what they're going to get used to. Whereas if we sit down and have vegetables and, cut up vegetables in the fridge instead of the potato chips or the pretzels or these are healthy because they have yogurt in them. All that stuff isn't necessarily healthy. It's better for you than a fried piece of food, but it's still, not the fruits and vegetables that we should really be encouraging our kids to eat.
So a healthy diet is always the best choice. And you've got a special event where you're bringing in a celebrity to help us learn how to fix healthy meals that look good and taste good.
Exactly. People just have this idea that healthy food is just horrible tasting food, and it is truly not. I know my husband and I have picked up some books, diabetic books, in fact, and are making recipes. Just neither one of us are diabetic, but they have great healthy recipes, and we have celebrity chef Rory Shepasy. She is from the Food Network. So we're really, really excited. The main thing she's known for is that she was a finalist on the next Food Network star. She's also part of Novo Nordisk diabetic education program, which is absolutely fabulous. And we're bringing that to Hannibal. It'll be next Saturday, May 3rd. We're really, really excited about it. What she'll be doing, we'll have some booths there that people can get educational material from area vendors and that, and then the certified diabetic educator from Novo Nordisk is going to give a presentation on Diabetes 101 and what's the best way to stay healthy. And then Chef Rory is going to be showing us how to make a very, very tasty pepper encrusted salmon with some creamy potato salad. And the pepper encrusted salmon is not real spicy. It's just a great flavor. And then with the event, we'll all be able to sample. The kitchen from the Quality Inn will be having the exact same recipe there, and everyone is going to be able to sample that same food that she had, which we're very excited about. And so you'll be able to get firsthand of how easy it is to make and how wonderful it tastes.
Good. That's a free event.
It is a free event. We're very, very excited. You do need to reserve your spot, though. We do have limited seating because of the fact that we are serving food. But I checked this morning, and we still have spots available. So we're very, very excited about bringing this event to the community, being that it is free and it's a celebrity chef coming. It'll be at the Quality Inn and Suites. It's from 10 a.m. to 2 p.m. And on May 3rd, Saturday, May 3rd, 10 a.m. to 2 p.m. at Quality Inn and Suites. And to call for your reservations, it's 573-231-0660. For those that missed it, it's 573-231-0660.
And these details on your website too?
They're on our website. You'll see them on various signs throughout the cities. And otherwise, if you forget if all else fails and you forget the phone number, call Hannibal Regional Medical Group, and we will get your reservation taken.
Great. And this is for people with or without diabetes?
With or without diabetes, for anyone who's looking for a healthy alternative. It's a fabulous event.
And again, diabetes becoming more and more prevalent. It needs more and more attention.
Yes, it does. And diabetic education is the key. Knowledge is power. And the more you know about diabetes, the more you're able to set your goals and know what's coming or what you want to prevent. It is truly your choice. I mean, if providers can only do so much, we can throw all the medicines we want at you, but if you're not willing to make lifestyle adjustments, those medications are going to be eventually limited.
Yep.
Yeah, that's with all medical issues, basically, right? I mean, you've got to
Exactly.
make the adjustments.
You need to make the adjustments, and with diabetes, a lot of the side effects, like the numbness and tingling and that, once it starts, it doesn't go away.
Yep.
It's not something that, we'll take this medicine and we can just all of a sudden fix it. Lifestyle adjustment is the key to it. In fact, I've had, through the diabetic center, we've had some very successful patients that have come in with a hemoglobin A1C of 14, and 6.5 is diagnosing diabetes. They come in with a hemoglobin A1C of 14. We discuss their diet and their exercise program, and 3 months later, just on one medication, they got down to a 6.3.
Good.
And
Awesome.
so diabetic, the lifestyle changes are just phenomenal of what they can do and help to prevent you from having to take multiple meds, too soon with this progressive disease.
Well, this is a good way to get started in being healthy, too.
It is. It is.
All right. Again, more information, 573-231-0660. Kim Peters, great information, and thank you very much for sharing this morning.
Thanks.
Thanks, Kim.
That's Kim Peters, nurse practitioner with Hannibal Regional Medical Group, our guest on Healthy Dose this week, brought to you by our friends at Hannibal Regional Hospital and Hannibal Regional Medical Group. More information online at hannibalhealth.org.